It has been 2 years since the city launched its mass COVID vaccination drive. Now, as the city pivots towards a post-COVID new normal, it's understood the government is considering whether to slash the number of COVID inoculation sites and only offer free vaccination services to high-risk groups. Jackie Lin reports.
After the government scrapped mandatory confinement for COVID patients, the next policy in line to be scaled back could be vaccination services. According to the latest government statistics, the average daily inoculation number over the 7 days leading up to Thursday stood at around 3,000. That's much lower than the daily number of 14,000 early this year. The daily vaccination number for the fourth jab meanwhile plunged from 10,000 to around 2,000. It's understood the government is studying whether there should be a mechanism in place to roll back the COVID vaccination drive. The idea is to continue vaccination services at public hospitals with a timetable to scale back inoculation centers and mobile vaccination stations in retrofitted containers. Dr. Lam Wing-Wall, a member of the government's scientific committee on vaccine-preventable diseases, noted the low appointment rates at government vaccination centers. Lam said the COVID inoculation drive could be adjusted like vaccination programs for seasonal influenza, which have more campaigns and services around peak infection months. Also, it's understood authorities are considering whether to only subsidize COVID vaccines for high-risk groups such as young infants and elderly people, just like the flu jab programs. William Choi, the president of the Society of Hospital Pharmacists of Hong Kong, said if COVID vaccines are no longer free of charge, one jab would set people back around $1,400 to $2,000. This is on par with the bivalent vaccines now offered at private clinics. A government advisory committee on vaccines is reportedly set to hold a meeting next week, but the agenda has no mention of whether vaccination centers will continue to operate. Jackie Lin, TVB News.